In progress. Mhm. All right, hopefully you can see my screen here. This is my voice presentation of my case study for DH 222A dental hygiene class of 2023. We have a lot to cover, so let's go ahead and get started. To briefly summarize, I selected this patient based on a periodontal diagnosis of stage 2, grade B, and the patient's high motivation to preserve her dentition. This patient had been given a preliminary diagnosis of, quote, gum disease, unquote, by Aspen Dental in January 2023, where they did some radiographic images, but no further treatment was performed. The patient was seen for a total of 5 treatment sessions at the LCC Dental Clinic between February and May of 2023. Vital signs were recorded at each appointment. The patient demonstrated a mild degree of dental anxiety at the initial session, but was more relaxed at the remaining 4. At the initial appointment, pre-treatment assessments were performed, including a thorough review of medical dental history and the patient's current home care and dietary routine. Patient reported it had been over 4 years since her last visit to a dental office, but that she brushes 3 times a day using both an electric toothbrush and a manual toothbrush. Risk factors were documented on the patient's treatment plan and were discussed during each session. The patient has 3 third molars present, which are major sites of plaque accumulation. She also has exposed root surfaces, class 1 furcations, major depressive disorder, and those all contribute to her risk of periodontal disease. Of note on the patient's medical history were allergies to both sulfa drugs and food preservatives. We therefore decided that the use of any local anesthetic would be limited to those without vasoconstrictor. Also performed at the initial session were additional assessments that included periodontal charting, comprehensive evaluation by the clinic dentist, plaque control index, and microscope evaluation. The microscope sample showed spinning and gliding rods, cocci, white blood cells, and spirochetes. The patient was informed of the findings and their associated risk factor. The dental hygiene process of care was followed throughout the course of treatment for this patient. A dental hygiene diagnosis of periodontitis stage 2 grade B was made during the initial session after reviewing both this panoramic X-ray and a full mouth series of radiographic images taken at Aspen Dental in January 2023. These X-rays showed localized moderate horizontal bone loss in the upper right quadrant with generalized slight horizontal bone loss. This diagnosis was further supported by findings of 3 to 4 millimeters interdental cal, class 1 furcations located on both the maxillary and mandibular arches, and the patient's age compared to the percentage of bone loss. Here is the comprehensive series of radiographs taken by Aspen Dental. Although these x-rays aren't of the best diagnostic quality, you can see the bone loss in the upper right quadrant. Also present is radiographic calculus throughout the dentition. These intraoral photos were taken at initial appointment in February. As you can see, there's evidence of hyperemic and diffuse edematous tissues with plaque accumulations noted interproximally throughout the dentition. There is staining present on the linguals of both the maxillary and mandibular anterior teeth as well. Here we have the side views showing edematous tissue and hyperemia with the interproximal and marginal plaque accumulations. The patient's perio chart shows generalized BOP with a total of 51 bleeding sites. The patient was noted to have 71 sites of 4 to 5 millimeters cal and 11 sites with 6 millimeters or more cal. Risk assessment was performed at the initial visit, where factors included irregular care, anxiety, depression, moderate and soft hard deposits, super erupted tooth number 17, furcation involvement, radiographic bone loss, and loss of attachment. These factors were taken into consideration when making our treatment plan. This plan included non-surgical periodontal therapy over the course of 4 to 5 clinic sessions. The patient was also assigned to a moderate risk category for development of carious lesions based on irregular preventative care and medications causing reduced salivary flow. The patient's medications were documented in her medical history, and this list included the antidepressant Lexapro, which is known to have effects of xerostomia. The Philips online risk assessment tool was utilized to place the patient at a high risk for periodontal disease based on yes responses to questions regarding bone loss, periodontal pockets, and generalized inflammation of the gingiva. Over on the right side of the screen here, you can see the recommended treatments that were produced by the online risk assessment tool. Upon interview conducted with the patient during the initial treatment session, we formulated specific goals to improve plaque control and begin NSPT treatment, as well as plan for the recommended extractions of number 17 and number 32. This patient demonstrated a high interest following through with the planned treatment and therefore was given a good prognosis at the time of the interview. Interventions planned for this patient included ongoing oral hygiene instructions to be performed at each visit, as well as periodontal scaling by quadrant, application of fluoride, and a reevaluation appointment at 4 to 6 weeks following completion of NSPT. The patient received a comprehensive examination by the clinic dentist to address her concerns of periodontal disease. On our treatment plan, as I said, we did 4 to 5 sessions with a reevaluation. Prior to beginning NSPT, this patient was given a consent form, which she reviewed thoroughly and asked questions related to her care. The document was signed and treatment was then initiated. So the initial session on February 21st, we started periodontal scaling and root planing, beginning on the lower right quadrant using local anesthesia. The patient was given mepivacaine 3% plain due to her food preservative and sulfa drug allergies. She reported experiencing some feelings of warmth at the back of her neck and fatigue immediately following the injection. I then explained that her anxiety had likely produced a slight rush of adrenaline, causing these symptoms. After giving the patient some time to relax, she reported no significant side effects after 5 minutes. Let's see, second appointment on March 8th. The patient was seen by a fellow student clinician for subgingival CRC, and the upper right quadrant was completed. Again, the patient reported feeling side effects following injection, including nausea this time. After 5 minutes, these effects subsided and treatment continued with no further complications. On March 11th, the patient presented for NSPT of the lower left quadrant, which was again a CRC performed by myself. This time, the patient had no complaints of side effects following local anesthesia, but did require modified chair position due to stomach issues related to her interstitial cystitis. April 11th was the patient's 4th appointment of NSPT, where we completed therapy of the upper left quadrant. There were no significant side effects during the administration of local anesthesia. There was noted to be improvement of the previously treated areas, and the patient was praised for her home care efforts. This patient expressed her satisfaction with treatment and agreed to return for reevaluation in 4 to 6 weeks. Significant improvements were noted at the patient's reevaluation appointment. This was on May 19th, 2023, the patient did report she's been struggling with plaque control, particularly interproximally and on the lingual surfaces of the mandibular anteriors. She continued to ask questions about ways to improve her techniques, and we discussed home care thoroughly. Oral hygiene instructions were given at each of the 5 appointments for this patient. Initially, toothbrushing technique was modified from a wide circular motion to a more focused VAS method. Interproximal flossing technique was demonstrated, and the rationale was explained to the patient. We also emphasized bacterial disruption interproximally and marginally using brushes, floss, and a water pick device. On March 8th, we discussed use of perio aid, and the clinician here explained how to use the toe of the toothbrush to reach into the interproximal and circular spaces. On March 11th, risk factors were again discussed, including the super-erupted third molar of number 17. This tooth in particular tends to harbor significant plaque accumulations. At the 4th appointment, the patient had a new complaint of sensitivity, particularly in her lower left quadrant around number 17. Explained to the patient that this was likely due to a decrease in gingival inflammation, which has led to increased exposure of root surfaces. I talked to the patient about the hydrodynamic theory of pain and how fluid moving through dental tubules stimulates nerve endings, causing sensitivity. Is at this appointment that the patient was instructed to place a desensitizing toothpaste, such as Sensodyne, on the sensitive teeth before bed and not to rinse this off. There was again evidence of stain and calculus buildup on our mandibular teeth, particularly the lingual surfaces. We continued to reinforce proper technique with the water pick device and demonstrated use of the perio aid to help with plaque control. At the reevaluation appointment on May 19th, we had an interview regarding home care, revealing that the instructions for perio aid use at the prior appointment were unsuccessful. The patient is very good about asking questions and showing interest in improving her technique. So we spent significant time at this appointment discussing home care, including a second demonstration of the perio aid using the tell, show, do approach. Additional information was provided to the patient, including the provision of an end tuft brush using a cross arch method to access the distal surfaces of numbers 1, 17, and 32. Patient stated that it was sometimes difficult to remember not to rinse after brushing her teeth at night, and we discussed burnishing the Sensodyne toothpaste onto the tooth surface using a cotton swab after brushing. As previously mentioned, the patient is very curious about different home care techniques. At each appointment, she was given a mirror to examine her own method versus proper methods demonstrated to her. She's highly motivated by periodontal disease theory and bacterial involvement, so we continued with patient education at reevaluation. She's very responsive to praise and was encouraged to keep up on regular professional dental care visits. She noted a positive response to NSPT and reported improvements in both soft tissues and her own home care habits. Several observations were made at the reappointment indicating healing of the gingival tissues. There was a reduction in bleeding points and inflammation with improvement in plaque control and OHI compliance. Although the patient did have interproximal soft deposits and grainy calculus in her mandibular molar regions at reevaluation, there was great improvement in regard to soft tissues. We did a second microscope sample. This sample placed her at a category A, whereas her initial visit was category B. All microscopic organisms at the second sample showed less mobility. The patient continued to report cold sensitivity, and there was more recession noted during the reevaluation assessment procedures. Here is the comparison perio chart, and as you can see, all these green numbers were improvements in probing depths at reevaluation. There were a few numbers in red, but these are likely attributed to either incorrect angulation of the probe or removal of deposit that was blocking the probe at the initial visit. Bleeding points significantly improved from an initial 51 to 15 at reevaluation. Clinical attachment loss of 4 to 5 millimeters was reduced from 71 sites to 32. And cal of 6 millimeters or more went from 11 to 5 at follow-up. I informed the patient of her progress and she expressed satisfaction with her care. The facial view intraoral photo on the left shows a significant reduction in hyperemia at the reevaluation appointment on May 19th. Maxillary facial tissues are more taut. There's a reduction in swelling, and the mandibular papillae are less bulbous as well. It's my opinion that this side-by-side photo comparison best shows the healing process after 5 weeks post-therapy. Again, as a comparison here, there is less marginal and papillary hyperemia and inflammation present at the follow-up, as noted on the image on the left side here. Continuing to the next slide. Again, you can see there's a reduction in marginal hyperemia. Unfortunately, the image on the left didn't capture number 17 as well as I would have liked. The tissue was improved, but this continues to be a problem area for the patient in maintaining plaque control. I included this next slide to show the lingual inversion and super eruption of number 17 to give you a better understanding of how the patient is struggling with home care here. Here is the maxillary lingual view side-by-side photo comparison. The photo taken at reevaluation shows nice tissue tone and color. The lingual retainer you can see is broken at the end. The patient actually reported that she cut this herself because it had been bothering her. The dentist did recommend removal of the segment on number 10 and smoothing of the wire on number 7. Same thing here on this next slide. The wire segments have been recommended for removal. You can see there is crowding of number 25. The patient removed the lingual retainer herself years ago, and the shifting has been slowly progressing. Tissues show healing with some regenerative growth of the gingiva on the mandibular anteriors. Based on the patient's diligence and home care efforts and improvement in tissue health, we recommended a 6-month recall for professional dental services, as well as continual application of Sensodyne on sensitive teeth. We used Oracix topical anesthetic at the reevaluation for management of sensitivity during scaling and polishing procedures. The patient received 2 topical fluoride varnish applications and will be scheduling extractions of number 17 and number 32 at the LCC Dental Clinic within the next 6 months. No other referrals were made. Overall, this patient has a good prognosis for stabilizing her periodontal condition, but she continues to struggle with plaque control in a few areas. I think it'll be of great importance to continue with technique modifications and demonstrations, as well as follow through with the recommended extractions. This case study was a great learning experience to track the healing process and give value to what we do as clinicians. The patient has demonstrated stability in her condition and an enthusiasm for her oral health. I believe our heavy emphasis on home care was very beneficial for this patient. In the future, I would ask more questions during the patient interviews to determine weaknesses in understanding or performance. All right, and that's what we have. Thank you so much for your time. Hope you enjoyed my presentation.